Yes, hello everyone. Today I would like to talk about a certain condition which is known as Takotsubo cardiomyopathy, also known as broken heart syndrome. Yeah, it's called broken heart syndrome due to the fact that it comes in when someone has gotten bad news or has broken suddenly due to the fact that he's about to get an accident, or when I received bad news that someone has died or has been checked by the boyfriend. Broken heart has been broken heart, yeah. So how it comes in, it occurs, it's a disease of the heart, whereby the heart's apex develops a certain push down, due to the much pressure of pumping blood on the left ventricles. So when this happens, actually this condition, most cases people mistake it as STMI, ST elevation, myocardial infarction. Yeah, of course, in this disease, we have the so-called elevation of the ST. Yeah, when you do ECG, you have ST elevated, and when you do angiography, there is ballooning at the apex of the heart. Yeah, when you do the angiography, that's the scan of the heart. And this disease normally occurs in ladies who are postmenopausal. As I've already told you, for this kind of disease, actually 90% of the patients are the postmenopausal. These ones have already undergone menopause, those who have already stopped producing. And remember, for this disease, as it happens, one has, how can you know that it's that kind of a disease? First of all, it presents with chest pain. There is a lot of chest pain there. That's why in most cases it can mimic, or it may try to resemble ACS, acute coronary syndrome. But for this kind of disease, it is temporary, and when you do the ECG, as I've already told you, you find that the ST is elevated. ST is elevated, and as you do the angiography, you see the ballooning on the side of the left ventricle. There will be some ballooning, the protrusion. Now, for this case, we have ways how it can be treated. But before I go to the ways how it can be treated, I need you to first understand the clinical features